Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about how to handle and care for child with depression. Many individuals believe that depression only affects adults. In fact, depression affects kids and teenagers as well. This is a very dangerous mental health issue that could potentially hamper child's growth. Recognize the signs of childhood depression very early. The first thing you must do is to watch for signs of childhood depression. The National Health Service states that it will be simpler to address these symptoms if you catch them early on. If your child exhibits these symptoms, you should pay attention. Lengthy periods of sadness and inactivity, angry and sensitive, lacks interest in pursuits or things they once found appealing, constantly appears exhausted, having trouble sleeping or sleeping more frequently, eating problems, even weight loss, lack of confidence, having trouble concentrating. How should a depressed child treated? In children, depression is a serious mental illness. You shouldn't worry too much, though, because your child will swiftly recover from this disease with your help as parents and relatives. 1. Act as a helpful parent. According to the Child Mind Institute website, you need to be a helpful parent when caring for a depressed child. Try to develop empathy for the child and picture yourself in their position. Recognize their emotions, but don't excuse their poor behavior. If they continues to do these things, let them know you are concerned. 2. Spend time conversing with them. When you are alone with your child, take the opportunity to approach them and make an effort to communicate if you think they are hiding a problem from you. Encourage children to have heartfelt conversations while they are walking or doing chores together, for instance. Make your child feel at ease so that they may open up. If they won't speak, don't be forceful and try again later. 3. Avoid lecturing and concentrate on listening. Allow them some room to speak and pay close attention. Rather than criticizing the child directly, resist the desire and let them express all of their problems. Even if the causes seem absurd to you, depression is a serious issue that should not be taken lightly. Even if you disagree with their viewpoint, try not to be judgmental. 4. Remain patient and kind. Children, especially those who are teenagers, find it difficult to reveal things that are bothering them on the inside. As a result, when tending to a depressed child, be patient with them. Even though the child may frequently yell and lash out, have patience. Recognize that they are currently struggling to regulate their emotions, and make an effort to make them feel at ease. 5. Avoid dictating children. Children genuinely only want to be understood when they are depressed. Consequently, refrain from dictating to a depressed child when providing care. They would become more depressed as a result. This is due to the possibility that they are also dissatisfied in themselves. Criticizing and dictating them will just make them feel worse about themselves. They will view you as a friend and a place to turn to when they are ready to communicate again if you listen to their stories without passing judgment. 6. Express your concerns. Parental intentions are frequently misunderstood as criticism rather than concern, despite the best efforts. So, let it be known when you speak that you are concerned about them. Clearly express your worries and your want to learn what is worrying your child rather than trying to correct them. The kid will feel understood that way. 7. Eliminate children's guilt. Child guilt can lead to depression. Remind them that everything that occurs is not due to their fault but rather a natural occurrence that should have occurred. Invite him to stand up after that so they may shed their remorse and regain his confidence. 8. Express appreciation for good behavior. Be careful not to overlook praising the good things your depressed kid performs every day when providing for them. Positive activities include attending class, cleaning the room, completing chores around the house, and playing with siblings on the weekends. Even if it's all really straightforward, when they are depressed it will seem burdensome. So if they keeps doing it, compliment them. Tell them that you are proud of them. 9. Consider psychological counseling. You might need to participate in psychiatric therapy if you're concerned that your child's depression will negatively affect their mental development and potentially their health. With the help of medications like antidepressants, some kids are able to successfully control their depression. The child may also require interpersonal therapy (IPT) and cognitive behavioral therapy (CBT) if necessary. Make sure you are caring for your depressed child while they are in therapy. When you invite your child to participate in treatment, some of them will. Others, though, might rebel. Try to approach them cautiously till they opens themselves to accepting the invitation rather than quickly forcing them to comply when they rebelled. The young patient must also have a strong desire to recover. The reason is that therapy typically is ineffective if the patient is not really committed to receiving it or is only participating in it because they feel obligated to do so. 10. Watch out for suicidal thoughts. Children who experience chronic depression frequently exhibit behaviors, thoughts, or actions that may lead to suicidal thoughts. Sadly, this is frequently interpreted as a typical adolescent act of attention-seeking. Suicidal inclinations, in fact, need to be handled urgently and with extreme caution. Therefore, be careful not to make mistakes when caring for a sad child. Ask for assistance from others, such as family members or experts, if you need it. Children that are depressed could have trouble being honest. They might have pretended there was no issue while keeping everything a secret. Trust your parental instincts if this occurs. Investigate it in many ways, such as by asking the closest friends if you sense something is off. To effectively treat your child's depression and identify the best therapy options, you must determine what is causing it. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.